So joining me now is Dr. Patrice Harris, the CEO of eMed and the former president of the American Medical Association. Dr. Harris, great to have you on this morning. Tell us about this new partnership.
Well, good morning, and thanks for having me. Yes, eMed is so proud to add Delta to our list of airline partners. You know, when travelers go abroad, it is necessary for them to test negatively on a test in order for them to re-enter the United States. And eMed absolutely wants to make that easy, accessible, affordable, and convenient. So through our digital health platform, travelers can test in the safety of their hotel room and get their negative results before they return back to the United States.
Why is testing still so important? Because a lot of people, I think, hear, well, I'm vaccinated, so I don't need to test as much. Why is that? Why is testing such a big part of solving the COVID problem?
That is a great question. And I will tell you from the very beginning, and it has not changed, we should be using all that we can to mitigate the risk of spread. And of course, now with the Delta variant, we need to do this even more so. And so, yes, now we have another tool in our toolbox that we didn't have at the beginning of the pandemic. We have vaccines, and I encourage everyone to become vaccinated, but we still need to make sure that folks are testing. We know that even those who are vaccinated are at risk, low risk, but are at risk of becoming infected and at risk for transmission, again, specifically with this Delta variant. So, you know, it's never been about one thing. It's always been about those layers of protection, layers of mitigation. So again, vaccines, testing, and yes, wearing a mask. So testing remains important.
How exactly does it work in terms of your test and the airlines? If you're taking a flight, do you get sent one of these tests at home?
Yes, we encourage everyone to plan ahead, order one of these tests through eMed.com, or they are available at Walgreens. I will say that everyone should make sure that the box says home test. There are several tests out there, but home test. And so plan ahead, pack this test in your carry-on, take it with you so that, again, 2 to 3 days prior to re-entry, you test, you sign up, and come to our website, take the test. We have certified guides walk you through the process. At the end of that process, if you are negative, you will receive a digital lab report as well as a digital certificate, and you will be ready to come back home.
How has testing improved since the start of the pandemic, and just how accurate are these at-home rapid tests?
So this at-home antigen test is very good at detecting when people are infectious, and that's what we want to know. We want to know who is at risk for transmitting the COVID-19, the SARS-CoV-2 virus to others. And so this antigen test is very good at detecting those who are infectious. And that is why we are offering this, but it's also about making it convenient and accessible and affordable. And using our digital health platform, we are able to do just that.
What does that mean, though? Does that mean that if you are not having symptoms that you wouldn't test positive? I don't know. Can you just explain that a little bit?
Yes, well, certainly we know that, and we've seen this throughout the pandemic, that you could be asymptomatic and still be positive. That is why it is so important. That's why testing is so important. And so it's very important for folks to, we say, know before they go and perhaps know before they return home. So these tests are very good at detecting whether or not you are currently infectious and at risk to transmit the disease to others.
Given that, I mean, do you think that airlines should be doing this and mandating negative tests for even domestic flights?
Well, that is certainly something that should be considered. Again, We have seen the rise in the Delta variant. We have seen those who are unvaccinated end up in the hospital. Reports all over this country of folks in the hospital unvaccinated. And now we are seeing younger folks. Before, early on, it was certainly folks who are old, who were older, but now we are seeing younger folks, even children, in the hospital. I'm a child and adolescent psychiatrist, and I'm very worried about that. And we know children younger than 12 cannot get the vaccine. So again, we should be considering requirements and mandates. Right now, we need to make sure that we do all that we can to prevent further spread, further hospitalizations, and further death from COVID.
All right. Well, such great insight. And look, the more testing, the better. Thank you so much, Dr. Patrice Harris, CEO of eMed and former president of the American Medical Association. Great to have you on.